Hello everyone. Let's start general pathology. Let's start chapter 1 of general pathology, that is cell adaptation, cell injury and cell death. Now this course is specifically designed for second prof MBBS students who are going to write their university exams. That's why I have divided chapter 1 into 10 topics. And I guarantee you all the long question, short question and very short question which are going to come in your university exam from this chapter will be from these 10 topics only. So let's discuss these 10 topics one by one. So let's start chapter 1, that is cell adaptation, cell injury and cell death. So these are the 10 topics I am talking about. We will be discussing these 10 topics one by one. In each topic, I will show you the long, short and very short questions which are usually asked from that particular topic in the university exams. Let's start the first topic, that is cell adaptations. Now from cell adaptations in university exam, usually the long question is asked. If the long question is asked, you have to write about all 5 types of cell adaptation along with their mechanisms, examples, everything you have to write. If a long question is asked in your exam, at least you have to write 5 pages. 5 pages of your copies for the long question. Now, if they ask the short question, they will be asking one type. One of the type of the adaptation. They will not ask 5 type. They will be asking one type only. So it's type, mechanism and example of any one type. Or they can ask you to differentiate any 2 of them. They can ask you the differences between in the short question. In very short question, they can ask you the definition or example of any one of them. So this is the long, short and very short question which are usually asked from this topic. Let's start the topic, the discussion, that is cell adaptation. Now to understand cell adaptation, you have to understand this diagram. Can you see human body from head to toe? We all are made up of multiple organs and all the organs are made up of cell. Cell is the structural and functional unit of life. In human body, all the cells are in homeostasis. So this is a cell you can see and all the cells normally are in homeostasis. Now what do you mean by homeostasis? Now each cell have a particular function, a particular structure and it is performing a particular function. So all the cells are assigned a particular function. For example, the cells of the salivary gland, they do the function of secretion. The cell of the intestine, they do the function of absorption. The cells of the brain, they do the function of the cognition. So all the cells in human body, they have a particular structure. Accordingly, they perform particular function. This is homeostasis. So all the cells in human body from head to toe, they are in homeostasis. But whenever any stress acts on the cell, the stress may be physiological, may be pathological. If any stress is acting on the cell, 3 things happen one by one. The first thing happen is cell adaptation. The cell will try to adopt the stress in order to cope up and survive. So in order to cope up the stress and survive, the cell is doing certain adaptations. There are 5 types of adaptations. I will be discussing all 5 here. Okay, one by one we will be discussing. Now, if the stress is removed, the adaptations are reversible. All 5 adaptations are reversible if the stress is removed. But if the stress is continued, the second thing which is going to happen is reversible cell injury. So cell injuries will happen. First, reversible cell injury. Now still, if the stress is removed, it's reversible. It's reversible if the stress is removed. But if the stress is continued, it will convert into irreversible cell injury. Now, even on removing the stress, it is irreversible. It is irreversible. It is not going to reverse. As the name indicates, it is irreversible because actually irreversible cell injury is cell death. Once the cell is dead, you cannot make it alive again. So it is irreversible even on removing the stress. So I'm telling you, all the cells are in homeostasis. So this is the cell of human body. It is in homeostasis. Whenever the stress is acting on the cell, maybe physiological, maybe pathological, 3 things happen one by one. What are the 3 things which are happening one by one? The first thing which is happening is cell adaptation. So let me explain you all about cell adaptations first. If the stress is continued, it will be happening. There will be reversible cell injury. And if this stress is still continued and it's very severe, it will convert into irreversible cell injury. By irreversible cell injury, I mean the cell will die. This is equivalent to cell death. The cell will die. It is equivalent to cell death. So this one is reversible, this one is reversible, but this one is irreversible even on removing the stress. Okay, so we'll be discussing all 3 one by one. Let's start with cell adaptation. Now you understood with this diagram what is cell adaptation. You can draw this diagram in your exam. Now you can define cell adaptation well. What is the definition of cell adaptation? The first thing you have to say, cell adaptations are reversible. I told you once you remove the stress, it's reversible. These are the structural changes in response to stress, the physiological stress or pathological stress. These are the structural changes inside the cell in response to the stress. The second thing you have to say. Why the cell is doing so? In order to survive and continue to function, and in order to achieve a new steady state. Currently, the cell is in homeostasis, but you have disturbed the homeostasis. Now, cell want to go in homeostasis again. Okay, that's why cell is doing so. Now, to understand it better, let me give you an example. Let me give you a beautiful example so that you can understand it better. Now, let me ask you a question. How many hours you study? Yes. How many hours you study normally? Can you tell me the answer? How many hours you study? So some students will say, ma'am, 6 hours, some 7 hours, some 8 hours. So maybe 6 to 8 or 9 hours routinely a medical student is studying. So this is your homeostasis. This is your homeostasis. You are studying for 6 to 8 hours daily. This is your homeostasis. Now let me ask you a question. How many hours you study one day before exam or few days before exam? The same question, but one day or few days before exam, how many hours you study? You will say, ma'am, maybe 15 hours, maybe 16 hours, maybe 18 hours. Very impressive. So exam is acting as a stress. Exam, and you do not want to fail. Nobody wants to fail. That's why you want to cope up and you want to survive. So that's why you are doing certain adaptations, certain changes inside you. So you are studying more. You are studying more. That is the adaptation in order to cope up. So this is the adaptation. So exam will last for 1 day, 2 day, maybe 1 week, whatever. So you are studying for 15 to 18 hours for that duration. That is adaptation. But imagine if the exams continued for 2 months, 3 months. What's going to happen? I mean, the stress is continued. So you will become sick. If you continue to study for these hours for a long period, you are not eating, you are not sleeping properly. So you will become sick. So that is reversible cell injury. The students will become sick, anyone will become sick. Now, still there is a time. If the exams are over, again, you will come in the equilibrium. That is 6 to 8 hours. And it's reversible. The diseases will reverse. But if the exams are continued forever, for a long duration, maybe 1 year, 2 years, forever, what will happen? The person will die. Nobody can study for 18 hours throughout the life for a long period. The person will die. So that is irreversible cell injury. That's irreversible. So this is the best example with which we can understand what are the three things happening one by one. Cell adaptation, reversible cell injury, and irreversible cell injury. So this is the definition of cell adaptation. No need to learn. You can write in your own language. The cell adaptations are reversible structural changes inside a cell in response to stress. So that in order the cell can cope up and survive and continue to function, and the cell can achieve a new steady state. This is the definition of adaptation. Now, there are 5 types of adaptation you have to understand. Hyperplasia, hypertrophy, atrophy, metaplasia, and dysplasia. So you have to understand the meaning of each of them, and we will see the details. See, this cell is a normal cell. Can you see this cell? This cell is the normal cell. Now, increase in size of the cell. Can you see this cell? Let me show you this cell. Just a second. This cell is a normal cell. Okay. Can you tell me the difference between this cell and this cell? This is a normal cell. Here you can see the increase in size, but not number. Here also one cell, here also one cell. So this is known as hypertrophy. Trophy means size. What you can see here you can see the number is increased. The size is not increased. The size here and here is same. But here you can see one cell, here you can see multiple cell. So increase in number of the cell is known as hyperplasia. Plasia means number. In pathology, trophy means size and plasia means number. So hypertrophy is increase in size and hyperplasia is increase in number. Okay, the third is, you can see this cell, this one, it is shrinked. It is decreased in size. Decrease in size is known as atrophy. Atrophy is reduction in size. Okay, reduction in size. The next is, now this cell will convert into some other mature cell. For example, this is squamous, it is converting into columnar. If it is columnar, converting into squamous. So it is known as metaplasia. Metaplasia is transformation of one mature cell into another cell. Okay, and finally here we are having dysplasia. What is dysplasia? Disordered cellular development. So there are 5 types of adaptation. See, hyper means more, plasia means number. So it is increase in number of the cell, not size. Again, hyper means more, trophy means size. So it is increase in size, not number. A means absent. Atrophy. So it is reduction in size as well as number of the cell. It is shrinkage. Metaplasia is transformation of one type of cell to another. That is squamous to columnar or columnar to squamous. And finally, there is dysplasia. Dysplasia is disordered development. These are the 5 types of adaptations you can understand. Now, If any adaptation coming in your university exam, you have to write down 4 things about that. And if any of them is coming, hypertrophy, hyperplasia, atrophy, metaplasia, dysplasia. The first thing you have to write the definition of each of them. I told you all 5 definitions together. So I guess you know the definitions. After that, you have to draw the diagram of each of them in your exam. Then you have to write the mechanism of each of them. And the ultra important is their types along with their examples. You have to write their types along with their examples. If any one of them, for example, you are getting a short question on this, you have to write the four things on each of them. If you are getting the differences between any two, you can differentiate between the two based on these 4 topics, headings, based on these 4 headings. And if you are getting a long question, you have to write down all 5 under these 4 headings. So let's start them one by one. Let's start the first one, hyperplasia. I will finish them one by one. In the end, we will fill this table completely together. So let's start with the first one, hyperplasia. As I told you, hyper means more and plasia means number. So it is increase in number. You know, it is increase in number of the cell, not the size. Say the negative finding also. So it is increase in number of cell, not the size. Please you learn, in pathology, plasia means number and trophy means size. Please learn. Plasia का मतलब होता है, plasia means number and trophy means size. So hyperplasia means increase in number and hypertrophy is increase in size. So please learn it by heart. Okay, so it will be easy. Now this is the definition we are done. Now see the diagram. Can you see this is a cell? This is in homeostasis. It is normal cell. When the stress is acting, it is increasing in number. You can see here we have one cell. Here we have multiple cells. But the size is same. You can see the size of this cell is equivalent to size of any of these. Size is not changing. Okay, so this is the diagram. Now, what are the 2 types? The 2 types of hyperplasia is physiological and pathological. I hope you understand what is physiological. Physiological is not a disease. For example, pregnancy in female, it's not a disease, but it's not normal condition also. For example, menstruation in female, it's not a disease, but it's not normal condition also. So that is physiological. Pathology means a disease. So tell me 3 examples of physiological hyperplasia and 3 examples of pathological hyperplasia. So you have to learn the 3 examples of each of them. You have to understand. Let's start with physiological hyperplasia. Okay, before that, let me tell you the mechanism. What is the mechanism of hyperplasia? What is the mechanism? Why the cell is increasing in number? Can you see a cell? This is a normal cell. See this cell. See this cell, this one is a normal cell. On the normal cell, there are growth receptors. Can you see the red color growth receptor I have drawn? This is a growth receptor. This is a growth receptor. So when the growth factor is coming, binding with the growth receptor, then only mitosis takes place. Otherwise, mitosis do not take place. What I said? On the surface of the cell, growth receptors are present. When growth factors are coming, binding with the growth receptor, then only the cell is dividing. Otherwise, the cell is not dividing. This is normal. This is happening normally. During hyperplasia, now see this cell and see this cell. During hyperplasia, the cell, due to the stress, the cell is increasing the number of the growth receptor as well as growth factor. You can see the number of the growth receptor is increased as well as growth factor is increased. So mitosis will be more. That's why increase in number will be more. From 1 to 2, 2 to 4, 4 to 8, 8 to 16 likewise. So simply you have to learn increase in growth factor and growth receptor. This is the mechanism. Just write down one line. Increase in growth factor and growth receptor. This is the mechanism of hyperplasia. Just learn it, understand it. Now tell me 3 examples of physiological hyperplasia and 3 examples of pathological hyperplasia. What are the 3 examples of physiological hyperplasia? The first example is the female breast. Let me draw female breast. Just a second. This is the pectoralis muscle and this is the female breast I am drawing. This is the nipple. These are the cells inside the female breast. These are the cells I am drawing. Okay. Now during 3 conditions. What are the 3 conditions? Let me tell you the 3 conditions. During puberty, pregnancy and lactation. Puberty, pregnancy, none of them is a disease. Puberty is not a disease. Pregnancy is not a disease. Lactation is not a disease. It's physiological condition. The size of the female breast increase. Physiologically, we know that the female breast size increases during pregnancy, during breastfeeding, that is lactation, and during puberty. Why it is increased? You know the reason? Because during these 3 conditions, actually there are hormones in the blood, the estrogen and progesterone, and that is acting as a stress. So that is acting as a stress for these cells. So these cells will increase in number, not the size. These cells will increase in number, not the size. Mind my words. I'm saying they are increased in number. not the size. If there are 10 cells here, here are 100. I'm just saying a number to understand, but the size is same. Since the number is increased, the overall breast size is increased. Since the number, now here only 10 cells are there, so size is less, the overall size of the breast. And here more cells are there, so overall size will increase. So that is the reason. So female breast, you can see the same diagram we try to draw here. This is the female breast. See the number of the cells here. This is the female breast. See the number of the cells here. So during pregnancy, lactation and puberty, during 3 conditions when the hormones are present in the blood. The second example is the uterus. Let me draw a uterus of a lady. So see, this is the uterus I am drawing. This is the myometrium of the uterus I am interested. Not endometrium. This is myometrium. This is the uterus. Now we know during pregnancy what happened. During pregnancy. What happens during pregnancy? You tell me. During pregnancy, the size of the uterus increases tremendously to accommodate the fetus inside that. The size of the uterus increases tremendously to accommodate the fetus. Why the size is increased? Have you ever thought? Why? How much? How it is increased? So inside the uterus, in the myometrium, these are the cells. Can you see? These are the cells in the myometrium. So during pregnancy, again, the hormones are present in the blood. The hormones, the estrogen and progesterone, and that is acting as a stress for these cells. So these cells will increase in number as well as size. I'm saying they will increase in number as well as size. They will increase both. So pregnant uterus is an example of both. It is an example of hypertrophy and hyperplasia. It's a common example. Physiological hypertrophy and physiological hyperplasia. Because here the cells are increasing in number as well as size. So currently I am teaching you hyperplasia. So it is coming in that example. The next I will teach you hypertrophy, in which also it will be an example. Pregnant uterus. So you can see here also, you can see this is a non-pregnant uterus, see the size. And this is a pregnant uterus, see the size. See the difference in the size. Now this is the gross. See the microscopy of both of them. Let's take a section here. Let's take a section here. This is non-pregnant and this is pregnant. We have taken a section correspondingly. I want you to appreciate the cells here, the size of the cells and the number of the cells. And I want you to appreciate the size and the number of the cells here. So your size and number both is increased during pregnancy. That's why the size is increasing. See the gross, see the microscopy. So that is uterus during pregnancy. Okay. So see the organ and see the stress. Hana, the third is the compensatory hyperplasia. What do you mean by compensatory hyperplasia? Humans have a pair of kidney. We all have a pair of kidney. Imagine if one of the kidney is lost, Hana, either due to some injury, due to some tumor, or it is donated to someone else. Okay, one of the kidney is lost. So the other kidney will increase in size. It's not a disease. It will increase to compensate the loss. Hana, the loss is the stress. One of the kidney is lost. That is acting as a stress. The loss of one organ is a stress. Okay. And there is compensatory hyperplasia. This don't happen only in kidney. It happens in the liver also in partial hepatectomy. So I told you 3 examples of physiological hyperplasia. I want you to learn the name of the organ. Hana, don't go in the detail. The details are for your understanding. Learn the name of the organ, that is female breast, uterus, and compensatory hyperplasia. Hana, compensatory hyperplasia. Learn the name and learn the stressor. I want you to learn the stressor in each of them. What is the stress? In female breast, the stressor is the puberty, pregnancy, and lactation, that is hormones during the 3 condition. In uterus, the stressor is the pregnancy, that is hormones during pregnancy. And in compensatory hyperplasia, the loss of the organ. The one loss, partial loss of the organ is a stressor. So learn the stressor and learn the organ, draw the diagram. These are the 3 examples. I hope you can draw the diagrams also. These are the 3 examples of physiological hyperplasia. Now coming on 3 examples of pathological hyperplasia. Now I will tell you 3 examples of pathological hyperplasia. Now again we will talk about the uterus. But this time in the uterus, I will be talking about endometrium, not myometrium. I will be talking about endometrium. Okay, you know females have a uterus, the organ uterus. There are 3 layers in the uterus: endometrium, myometrium, serosa. We are interested in endometrium. Endometrial lining. Can you see the endometrial lining? It is shedded every 28 days in the form of the menstruation. The female have the bleeding. It is physiological. So every 28 days, normal females have menstruation in which the endometrial lining is lost in the form of the bleeding. It is normal. It is normal. Now, if this female is exposed to estrogen, if estrogen is more in the blood, maybe she's taking some tablets, she's taking some chemicals, she's eating certain food which contain abundant of estrogen, and estrogen content in the blood, estrogen concentration in the blood is more. That is acting as a stress for these cells. So what these cells will do, they will increase in number. They will divide. They will increase in number, not the size. They will increase in number, not the size. It is known as, है ना? So what? It's a disease. It's not normal. And these females will bleed heavily. There will be abundant bleeding during menstruation or between two menstruation, intermenstruation also. So they will present to the gynecologist that, doctor, I'm having abundant bleeding, so much of bleeding during the menstruation and intermenstrual period also. So it's a disease. So we will see the sonography, we will do an ultrasound, pelvic ultrasound, and we will find the endometrial thickness is more. Why the endometrial thickness is more? The endometrial lining is thickened because the cells are dividing. Why the cells are dividing? There is a stressor. Stressor is the estrogen in the blood. Got it? This is the disease. And the name of the disease is endometrial hyperplasia. Endometrial hyperplasia, it occurs only in females, obviously, because uterus occurs only in females. So it's a disease in female. So the name of the disease is endometrial hyperplasia, and the stressor here is the estrogen axis. That is for your understanding. You have to write down the disease with the stressor. That's it in exam. For your understanding, I told you the detail. Okay, endometrial hyperplasia is the name of the disease. And the stressor here is the estrogen axis in the blood. You can see, you can draw. This is the first uterus. See the lining. See the lining of the endometrium. And see the second uterus. See the thickness. See the lining. So you can see the endometrium is thickened, because the lining, there is increased mitosis in the endometrium. Okay, this disease occurs only in females. Now tell me one disease which occurs only in males. Only in males. So the name of the disease is the prostate. The organ is the prostate. The males have an organ. The males have a gland. The name of the gland is prostate gland. Here I am drawing the urinary bladder and the urethra. This is the urinary bladder and the urethra. So the males have a gland. The name of the gland is prostate gland, which is present at the you can see at the urethra, where the urethra is starting. So there is a hole in the center of the prostate from which urethra is passing. There is an orifice from which the urethra is passing. It's a circular, it's a spherical gland. The name of the gland is prostate, and these are the cells of the gland. I'm drawing the cells of the gland. Okay, this is normal. This is normal, and here the urine is passed from here. The urine is passed from here. This is normal. It is a healthy male. Now, in some males, if the testosterone in the blood is more, basically it is dihydrotestosterone to be specific. If the dihydrotestosterone in the blood is more, it acts as a stress for these cells. It acts as a stressor for these cells. So what does these cells will do? These cells will increase in number. They will divide, and they will increase in number, not the size. They will increase in number. Since they will increase in number, the size of the gland will increase, and it will compress the urethra. It will compress the urethra. The urethra will get compressed. So such males will present to the urogenital clinic with the emergency. They cannot void. They cannot pass the urine. They feel the bladder is full. They feel their bladder is full. But once they start the process of the micturition, the urine is coming dribbling, drop by drop. It is dribbling. Usually if the bladder is full, once the person start voiding, once the person start micturition, the urine should come in a flow, in a full flow if the bladder is full. So whenever the bladder is full, we have a feeling that the person should use the washroom and micturate. So whenever the person is using the washroom and micturating, the urine is coming in a flow. But here the person is feeling the bladder is full. But whenever he is trying to micturate, the urine is coming drop by drop. So what is the name of this disease? Or sometimes it's a complete obstruction. The urine is not at all coming out. It's an emergency. We have to catheterize the patient immediately. Okay. Otherwise bladder can rupture. The name of this disease is benign prostatic hyperplasia, BPH. It occurs only in males because this gland is present only in males, not in females. So the name of the disease here is benign prostatic hyperplasia, and the stressor here is dihydrotestosterone. Learn the stressor. Learn the stressor. So you can see here, this is the gland, the prostate gland in a normal male, and see the prostate gland in a person having BPH. So it is compressing the urethra. Here you can see the urethra is open, and here you can see the urethra is compressed, the urine is not coming out. This is the second example. So I told you first example only in females. The name of the disease is endometrial hyperplasia. Second example only in males. The name of the disease is benign prostatic hyperplasia, and third example is skin warts. It is present in both males as well as females. Have you heard about a virus? The name of the virus is HPV, human papilloma virus. This human papilloma virus enters human skin. So this is the skin. The cells of the skin are keratinocyte. So imagine these are the keratinocytes. These are the keratinocytes of the skin, inside which HPV, human papilloma virus, is entering. So the cell in which it is entering, it is acting as a stress. This virus is acting as a stress. So in response to the stress, this cell in which it is entering, it will divide. It will do the mitosis, divide. It will increase in number and it will produce a nodularity here that is known as warts. Can you see small warts? It is due to division of the keratinocyte. Can you see here? Can you see this is virus? This is the HPV virus. It is entering in this cell. So this cell is dividing and forming warts. The name of the disease is warts. So I taught you what I taught you? I taught you the first thing, hyperplasia. We are done with hyperplasia. In the hyperplasia, I taught you the definition of hyperplasia. I guess everyone know the definition. I taught you the diagram. I taught you the mechanism, and I taught you the types, the two types with the examples. So we will revise it quickly. The definition I told you, it's increase in number, not the size of the cell. Increase in number, but not size. Diagram you can draw. So here one cell, and due to the stress, it become multiple. It become multiple cell. You can draw, but the size is same. So that is the diagram. Mechanism is increase in growth receptor and growth factor. I told you, you have to learn this line, and I have explained you also. Now coming finally on the types. Coming on the types. In the types, I taught you there are two types, physiological and pathological. And you have to tell me three examples in each of them. So tell me 3 examples with their stressor and tell me 3 examples in their stressor. The things are for your understanding in detail. You don't have to write every detail in your exam. You have to just write down the adaptation with their stressor. So in the physiological, the 3 examples are, the first is female breast. Okay. The second example is the uterus. Okay. And third example is compensatory hyperplasia. Okay, that is the third example. Now tell me the stressor of all 3. Can you tell me? So here the stressor, it occurs during pregnancy, puberty and lactation. The stressor is the hormone. Here at uterus, there is pregnancy, increase in size due to pregnancy. Again, the stressor is hormone. Here also hormone, and here loss of the organ, partial loss of organ. That is the stressor. So write down the organ with their stressor. In the pathological hyperplasia, tell me the disease, name of disease. One is in female. That is endometrial hyperplasia, the name of the disease. One is in male, benign prostatic hyperplasia. So here endometrial hyperplasia, here prostatic hyperplasia. One is in female, one is in male, one is in both. That is warts, skin warts. Now tell me the stressor in all 3. Can you tell me? Here the stressor is estrogen in the blood. Here the stressor is dihydrotestosterone in the blood. And here the stressor is HPV virus. Now just write down the name of the organ or disease along with the stressor. That's it. And draw the corresponding diagrams wherever applicable. You can draw. I have shown you the diagrams of all 6. That's it. You don't have to write the detail which I have explained you for your understanding. Okay. This is the first session. I'm giving you so much detail. Otherwise, we will be running very fast. Okay. So first adaptation is done. Let's come on the second adaptation, hypertrophy. We are done with hyperplasia. Coming on hypertrophy. I told you hyper means more. Trophy means size. So it is increase in size, not number. It is increase in size, not number. See, this cell is in homeostasis. So whenever the stress is acting on that, it is increasing in size, not number. Here also we have one cell, here also we have one cell. So draw this diagram in your exam. So write down the definition, draw the diagram and tell me the 2 types. The 2 types here also physiological, pathological. In physiological, tell me 2 example. In pathological, tell me 2 example. Tell me 2 example in each. Okay. Before that, tell me the mechanism. What's the mechanism? Why the cell is increasing in size? See, this is a normal cell. Inside the cell, these are the cell organelles. You can see the mitochondria. You can see the endoplasmic reticulum. You can see these are the cell organelles. So whenever the stress is there, due to the stress, the cell organelles are increasing. You can see more mitochondria, more endoplasmic reticulum, more ribosomes. All the cell organelles are increasing. Because there is more structural component in cell organelle, that's why the cell is increasing in size. If you remember the mechanism of hyperplasia, I told you there is increase in growth factor and growth receptor. Here there is no increase in growth factor, growth receptor. Here increase in cell organelles. That's why the cell is increasing in size. It's not swelling, simple. The cell is taking water and it is swelling out. No. It's not like that. It is increase in cell organelle. This is the mechanism. Now tell me 2 examples of physiological and 2 pathological. I guess one physiological you already know. One physiological example, which is the common example of hypertrophy and hyperplasia. So that is pregnant uterus. I told you uterus during pregnancy. It is a common example in physiological and hypertrophy and physiological hyperplasia. So you can see this is a non-pregnant uterus. This is a pregnant uterus. This is non-pregnant. This is pregnant. Take the section here. Take the section here. This is non-pregnant. This is pregnant. So you can see the size of the cell here, the number of the cell here, and you can see the size of the cell here and the number of the cell here. You can see the size and the number of the cell here and here. So the cells are increasing in size as well as number. So it is an example of both hypertrophy and hyperplasia. That is the first example. Second example is skeletal muscle. How many type of muscles are there in human body? There are 3 type of muscles: skeletal muscle, cardiac muscle, and smooth muscle. So skeletal muscle is coming in physiological hypertrophy, and the remaining 2 muscle will come in pathological. So somebody among you do the gymming. When we do the gymming, why we do the gymming? What is the purpose? We want to increase the size of the bicep and tricep. Bicep, tricep, deltoid. We want to increase the size. So if someone is doing very laborious work, so the size of bicep, tricep increase. Have you ever thought why? Now see, this is the bicep. These are the cells inside the bicep I'm drawing. These are the cells inside the bicep. I'm drawing the cells. Can you see? These are the cells. Now someone, if doing the laborious work, gymming or something like that, laborious work, that is acting as a stress. That is acting as a stress for these cells. So basically these cells will not increase in number. They will increase in size. The number will remain same. The thing is that they will increase in size. They will increase in size. And that's why the muscle will, here also 10 cells, here also 10 cells. The number is same, but the size is increased. Since the size is increased, the muscle size, overall muscle size is increasing because each cell inside that is increasing in size. This is the reason. You don't have to write the detail, it is for your understanding. Skeletal muscle during laborious work, in athletes and laborious work. So this is the example, the physiological hypertrophy. The 2 examples are in front of you. Coming on pathological hypertrophy, here also we are having 2 examples. I told you skeletal muscle is coming here. The remaining 2 muscles will come in pathological. What are the remaining 2 muscles? The cardiac muscle and the smooth muscle. So let's come on the cardiac muscle. Can you see the diagram of heart? Can you see all 4 chambers? So I am interested in left ventricle. Can you see left ventricle? Let me show you left ventricle here. So this is the left ventricle here. You can see this is the left ventricle. So when the left ventricle is contracting, what happens? The blood goes in the aorta. When the left ventricle contract, the blood goes in the aorta and get distributed in all the organs. We know that. So here is the aortic wall. Here is aortic wall. The aortic wall is opening, and when the left ventricle is contracting, the blood is going in aorta. But imagine if someone is having aortic stenosis. The aortic wall is not opening. So when the left ventricle is contracting, the blood is not going in the aorta. The blood is not going in the aorta. The blood remains in the left ventricle only. So the more blood is there after systole, and that is acting as a stress on the wall of the left ventricle. That is acting as a stress. That is acting as a stress on the wall of the left ventricle. So let me draw the wall of the left ventricle to show you here. So let's draw, this is the thickness of the wall. And these are the cells present inside the wall of the left ventricle. Now here there is more blood now. That is acting as a stress. So these cells will increase in size and the left ventricular wall will get thickened because each of the cell, can you see each of the cell, it will increase in size. It will increase in size because of the stress. It will increase. So overall thickness of the left ventricular wall will increase, and the name of the disease is left ventricular hypertrophy. LVH, that is left heart failure. It's a disease. It's a disease. It's not physiological condition. See, if I'm cutting the heart from here and looking from above, see normally I can see 2 lumen. You can see this is right ventricular lumen. This is left ventricular lumen, and see the thickness of the wall. See the thickness. I want you to appreciate the thickness of the left ventricle here. Now in aortic stenosis, the same thickness. Please appreciate. The lumen get narrowed and the thickness of the wall is more. Why? Because the cells inside the wall. So here are the cells we are having. These are the cells. The cells inside the wall. Each of the cell inside the wall, it increased in size, not the number. It is increasing in size. That's why the wall gets thickened. So the name of the disease is left ventricular hypertrophy. It is seen in aortic stenosis or systemic hypertension. That is acting as a stress. So this is the first example of pathological. The second example is a smooth muscle. The second example is a smooth muscle. Can you see this is esophagus and this is stomach. At the junction of esophagus and stomach, there is a sphincter. The name of the sphincter is lower esophagus sphincter. This is lower esophagus sphincter, LES, lower esophagus sphincter. Normally it is closed. Currently it is closed in me because I am not eating anything. But once we eat anything and swallow anything like that, at that time it is opening and allow the passage of the food from the esophagus to the stomach like this. So it opens only when we chew and we swallow. Otherwise it is closed. That is lower esophagus sphincter. Now in some persons, due to neurological, the neuron damage, the inhibitory neurons get damaged, that will act as a stress. The cells inside, these are the cells inside, है ना, they will increase in size. The cells inside LES, they will increase in size, and because it is increased, it get thickened. Since it get thickened, it is permanently closed. It is permanently closed. Even on swallowing, it is not opening. Even on swallowing, so food cannot be passed from esophagus to stomach because LES is permanently closed, because the cells inside that, they increase in size because of the neurological damage. So that the name of the disease here, it is known as achalasia. Achalasia is the name of the disease. The name of the disease here is known as cardiac achalasia, in which you can see here. Here you can see the sphincter, it is opened on swallowing. Here it is permanently closed because the cells inside that increase in size. So this is the example. Got it? So till now we have covered two. We are revising the two. So we have done hyperplasia as well as hypertrophy. We have done 2 adaptations out of 5. 2 are done. At least 2 are done. Okay. So you know the definition of both of them. I guess you can say the definition. This is increase in number and this is increase in size. So you can understand the definition of both of them. You can draw the diagrams also. Here one cell will convert into multiple cell, but the number is increased, size is same. Here one cell is converting into one only, but the size is increased. You can write the definition of each of them. You can draw the diagram of each of them. You can see. Now the mechanism. What is the mechanism of each of them? Can you tell me the mechanism? Here the mechanism is increase in growth factor and growth receptor. And here the mechanism is increase in cell organelles. The cell organelles, that's why cell is increasing in size. The more mitochondria, more endoplasmic reticulum. Now tell me two types in each of them. What are the two types? Here physiological and pathological. And here also we have the 2 types as physiological and pathological. I want you to learn 3 and 3 examples over here. And I want you to learn 2 and 2 examples over here along with their stressor. So please learn the 3 plus 3, 2 plus 2 example along with their stressor. You want me to tell it? I will tell you once. Okay. So here the 3 examples I told you. The female breast, okay, uterus during pregnancy and compensatory. So tell me the stressor. In female breast, it's puberty, pregnancy and lactation, the hormones. In uterus, it's pregnancy, that is hormones. And in compensatory, the loss of organ is acting as a stress. So these are the 3 physiological here. And here the physiological one is common, uterus during pregnancy. So one example, uterus during pregnancy is common in both of them because in pregnancy, in uterus, there is physiological hypertrophy as well as hyperplasia. The second example is the skeletal muscle. Skeletal muscle. Skeletal muscle during laborious work, the gymming, the laborious work. The laborious work is acting as a stress. The cardiac muscle and smooth muscle will come here. I told you the cardiac muscle and in cardiac muscle, the name of the disease is LVH, left ventricular hypertrophy. The stressor is the aortic stenosis. In smooth muscle, the name of the disease is achalasia. And the stressor here is the loss of neurons. Okay, here the pathological hyperplasia, the 2 examples I told you, 3 examples. One is in female, that is endometrial hyperplasia. The stressor is estrogen. One is in male, benign prostatic hyperplasia. The stressor is dihydrotestosterone. And one is common in male and female, that is warts. The stressor here is HPV. So it's very easy to learn. Learn the name of the disease organ with their stressor. That's it. That's it. You don't have to write their detail why it is happening. No, it is for your understanding. So the hyperplasia is done. The hypertrophy is done. Draw the corresponding diagrams in all these examples. Okay, now coming on the third. The third type of adaptation is atrophy. So let's come on atrophy. So it is decrease in size and number. So I told you increase in size, what is it known as? Increase in number, what is it known as? And I'm telling you now what is decrease in size as well as number. Size and number both together is known as. So increase in size is hypertrophy. Trophy means size. Increase in number is hyperplasia. Plasia means number. Decrease in size as well as number is atrophy. So for reduction, we don't have 2 terms. For increase, we have different term for size, different term for number. But for reduction, we have same term for size and number, that is atrophy. Atrophy is reduction in size as well as number. It is for both. Okay, so it is reduction in size. So see, this is a cell. It is in homeostasis. Whenever the stress is acting, it is reduced. It is shrinked. It is reduced. So you can draw the diagram. It is reduced. Okay, now it is of 2 types again, physiological and pathological. Okay, so you have to tell me 4 examples over here and 7 examples over here. So 4 plus 7 you have to learn here. So we will see the examples. Before that, see the mechanism. What is the mechanism of atrophy? You can see this is a normal cell here. You can see the cell organelles. Here the cell organelles get reduced. You can see the mitochondria, endoplasmic reticulum, ribosomes, they all get reduced. It is the reduction of cell organelle. It is opposite of hypertrophy, atrophy. So you can see the cell is reduced in the size. So this is the mechanism. Reduction of cell organelle is the mechanism. Now tell me the 4 example of physiological and 7 examples of pathological. 6 or 7 examples we will see. So first we will see physiological. In the physiological, tell me few examples. So we have a thymus as a gland. So whenever in fetus it is present, but as the person grows up, it disappears. So thymus in adult life, it get disappeared. So thymus in adult life get disappear. Ovaries, females have ovaries, but after menopause, when the menstruation gets stopped, the ovary gets shrink in size. So after menopause, the ovaries get shrink in size in females. Brain during aging. During aging, can you see this is brain? This is brain of a 25-year-old male. This is the brain of the same person in 80-year-old. What's the difference? See the difference. See the gyri and sulci here, gyri and sulci here, and see the gyri and sulci here. So here you can see during aging, the sulci get deepened and the gyri get thinned out. You can see there is less gyri get thinned out, but the sulci are more deepened because the parenchyma is disappearing. The brain is shrinking in size. It is shrinking. It is doing the atrophy. So with aging, it's normal. It's normal. It's not a disease. It's normal. So I guess we all have this brain right now. I'm also having this brain. I'm not very aged as compared to you, I guess. During old age, our brain will be like this. Okay. So this is the brain. Brain with aging. Okay. So first example, thymus in adult life, it disappear. Ovary after menopause, it shrink because of atrophy. And brain with aging, the brain with aging is also getting atrophied. Okay. Now uterus is the best example. Can you see this is the normal uterus? I told you during pregnancy what is happening. During pregnancy, the uterus increases in size. Why? Why the uterus is increasing in size during pregnancy? Because of hypertrophy and hyperplasia to accommodate the fetus inside that. So uterus, pregnant uterus is coming in both example, physiological hypertrophy and physiological hyperplasia. It is coming in both. Okay. Now after delivery, after parturition, once the newborn is out, after delivery, uterus again shrink in size to become normal size. After parturition, it again shrink in size to become normal size, and that is due to atrophy. So uterus is coming in all example. And in 3 examples, I mean. So during pregnancy, it is an example of hypertrophy and hyperplasia, and after parturition is the birth. After parturition, the uterus is coming in an example of atrophy to shrink in size again. So uterus after parturition. So what are the 4 organs you have to learn? Physiological mein, thymus. The thymus get disappear in adult life. Ovaries in female after menopause. Okay, brain during old age. And the last example I told you, uterus after parturition. They all shrink in size. Shrinkage is due to atrophy. Shrinkage is due to atrophy. Okay, so this is the physiological. They are not disease. Now coming on the examples of the pathological atrophy. Come on the examples of pathological atrophy. So there are 7 examples. One by one we will see. Can you see this person? This person is having some terminal disease, some cancer or some terminal disease, and the person is not eating since long because the person is diseased. The person is sick. The person is having some disease. So this is known as the person, all the organs are reduced. All the organs are reduced in size inside the person. This is known as cachexia. And the reason of the cachexia is starvation atrophy. The person is not eating, starvation. So deprivation of food is there. Due to the deprivation of food, starvation atrophy is there. The first example. Second, can you see there is an aorta here? From the aorta, the renal arteries are coming, supplying blood to the kidneys. The 2 renal arteries are there. Now this renal artery is obstructed. Can you see? So size of this kidney in which the renal artery is obstructed is less as compared to the size of the other kidney. You can see. So here, why the size of this kidney is less as compared to other kidney? Because of this kidney is getting less blood. It is known as ischemic atrophy. It is due to deprivation of blood. Any organ, not only kidney, if any organ do not get the blood, the size of that organ get reduced, and it is known as ischemic atrophy. It can occur in kidney because of the obstruction in renal artery. It can occur in the brain because of obstruction in the cerebral artery. Okay, so this is ischemic atrophy. It is due to deprivation of blood. See the third. Can you see these persons have polio? Have you heard about polio? It's a disease in which the limbs, the paralytic limbs, in which the polio is there, they're very thin. Have you seen a polio person ever? So the limbs are very thin. Have you ever thought why the limbs are thin? No, polio is a virus. Polio is a virus that attacks the nerves, that damages the nerves supplying the muscles. The muscles of the limbs, upper and lower limb, they are normal, but the nerves supplying the muscles get damaged by the virus. That's why the organ is shrinked in size. It is neuropathic atrophy. It is due to deprivation of nerve. Here the nerve supply is not there. The proper nerve supply is not there. Example, the best example is polio. The next is the disuse atrophy. Imagine I have a fracture over here in the humerus. Okay, I have a fracture over here. So you are an orthopedician. What you will do? You will put a cast over here and you will say, ma'am, don't use this limb for 2 months, 3 months. There is a cast. After 2 or 3 months, whenever I am removing the cast, I have seen this arm, this limb is thinner as compared to the other. Why? Why does it get thinner? Currently, they both are equal. But why it will become thinner? Because I have not used for a long time. If we don't use any organ for a long time, there is disuse atrophy. The organ gets shrink in size because we are not using it, because of lack of use, deprivation of use. So deprivation of food leads to starvation atrophy, that is cachexia. Deprivation of blood leads to ischemic atrophy, example is kidney. Okay, deprivation of nerve leads to neuropathic atrophy, example is polio. And deprivation of the use is disuse atrophy, example is cast. If you are putting any cast in a fractured limb, that limb get atrophied once you remove the cast. You can see here, this limb is thinner than, because here you have put a cast. And after removing the cast, you can see it is thinner. There is a fourth example. The fifth example, endocrine atrophy. You have to understand the axis in human body. We have hypothalamus over here. This is the hypothalamus. And after that, we have a pituitary over here. This is a pituitary. And we are having here organs. Hana, I'm talking about 4 organs. Thyroid, okay, adrenal, okay, and here the gonads. By gonads, I mean ovaries in female and testes in male. You know, from the hypothalamus, there is TRH. It is coming, Hana, TRH. From the pituitary, TSH comes over here. ACTH comes over here. And FSH and LH. FSH and LH come over here. You got my, you know this axis, I guess. And here GnRH, TRH and other things are coming. This is the axis, hypothalamus, pituitary and organs. Hypothalamus, pituitary. Imagine a thing if the pituitary get damaged. If the pituitary is absent. Either it is congenital, God forgot to give the pituitary, number 1. Or it is damaged, it is having some tumor, it is having trauma, it is damaged. It is non-functional. So if the pituitary is not functional, in those persons, all these organs are reduced in size. The thyroid is small in size. The adrenal is small in size, and the gonads, ovaries or testes are small in size because the hormones are absent. Hana, it is known as endocrine atrophy because of deprivation of hormone. So endocrine atrophy is due to deprivation of hormones because the pituitary is damaged. So all these organs are reduced in size. The thyroid, the adrenal and the gonads. So that is endocrine atrophy. The next is the pressure atrophy. What is pressure atrophy? Due to the pressure of one organ, the other organ reduced in size. So can you see? You can see the imaging of the brain. Can you see the white color is the skull bone? I'm having a skull bone. Can you see the white color? Can you see? Now here the meninges we are having. There is the tumor meningioma. Can you see here? This is meningioma. This is meningioma. It is compressing the skull bone. So in this area, the skull bone get atrophied. Everywhere I can see a white skull bone. But in this area, the white is reduced. The skull bone get compressed by meningioma and it get reduced. It got shrinked. So this is pressure atrophy. It can occur anywhere. And if none of the causes known, it's idiopathic. If none of the causes known, it's idiopathic. We are done with atrophy. The third type of adaptation is atrophy. I guess everyone knows the definition. What is the definition? I guess everyone knows the diagram also. And you know the mechanism also. Okay, the most important thing you have to learn is their types with the example. So what is the definition? Say reduction in size and number both. Size and number of the cell. That is the definition. Diagram you can draw. This is one cell and due to stress, it reduced in size as well as number. The mechanism is reduction in cell organelle. The reduction in the cell organelle. Now coming on the 2 types. What are the 2 types? Can you tell me quickly? And with their examples, we will revise it quickly. What are the 2 types with the example? Atrophy. So here we have physiological and pathological. Okay, physiological we have only 4 examples. Okay, and in pathological we have 7 examples. So tell me quickly, we will revise. In physiological there are 4 organs. Thymus, brain, ovary and uterus. Okay, tell me when they occur. Tell me the stressor. Thymus with aging. Okay, brain with aging. Ovary after menopause. Okay. And uterus after parturition, after birth, parturition, after delivery. So this is the stressor. The organ with their stressor. That's it. Don't go in detail. Organ with the stressor. That's it. Coming on pathological. It can be deprivation of food, that is starvation atrophy. It can be that the starvation atrophy, and example is cachexia. Okay. It can be deprivation of blood, that is ischemic atrophy. Example is renal artery get obstructed. If the deprivation of nerves is there, it is neuropathic atrophy. Example is polio. If the deprivation of use is there, it's known as disused atrophy, and example is cast after fracture. If deprivation of hormones is there, it is endocrine atrophy. The example is hypopituitarism. The three organs get reduced in size. Or along with that, it can be pressure atrophy. It can be idiopathic. So I have given you example of everywhere. So you have draw wherever applicable, try to draw the diagram. Wherever you can draw. Try to draw maximum diagrams in your university exam if you want to get good marks. Now the next adaptation is metaplasia. Let's come on metaplasia, the fourth one. Here, squamous get converted to columnar because of the stress, or columnar get converted to squamous. Columnar get converted, you can see this is columnar get converted to squamous because of the stress. So initially the cell is squamous, because of the stress it get converted to columnar, or vice versa, initially it's columnar get converted to squamous. Okay, so what is the definition? One mature cell is replaced by another mature cell. So this is the definition. One mature cell get replaced by another mature cell. This is the definition of metaplasia. You can see this is the definition. Okay. Now there are two types, the squamous and columnar. It's not physiological and pathological. I taught you hyperplasia first, then hypertrophy, and then atrophy. And now I'm teaching you metaplasia, the fourth one. The two types here is physiological, pathological. Here also physiological, pathological, but here we don't have physiological, pathological. Here the two types are squamous metaplasia and columnar metaplasia. That's what I mean. Because metaplasia is always pathological. It's never physiological. It's always pathological. So you have to understand the two types is squamous and columnar. What do you mean by squamous metaplasia? And what do you mean by columnar metaplasia? Now students always have confusion here. Please understand. Please understand. Here initially the cell is columnar and finally squamous is formed because of the stress. That's why it's known as squamous metaplasia. Whatever is the metaplasia, finally that thing is formed. Here it is columnar metaplasia. So initially the cell is squamous and due to the stress it get converted to columnar. So finally columnar is formed. So because of the stress, finally what is formed? You have to see that thing. Finally what is formed? Finally squamous is formed, it's squamous. Finally columnar is formed, it's columnar. So that is the two types of metaplasia. Okay, what is the mechanism? What is the mechanism? Now you can see this is an organ. In this organ, initial lining you can see is columnar. Initially lining is columnar. Now few of the cells are stem cell. Maybe this is a stem cell. Few of the cells are stem cell. Okay, this stem cell give rise to columnar, 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 columnar. So columnar lining is there. It's normal for this organ. But due to the stress, now there is a stress. So due to the stress, there is reprogramming of the stem cell. See the word what I'm saying? Reprogramming of the stem cell. The stem cell get reprogrammed. The stem cells get reprogrammed. Because of reprogramming of the stem cells, now these cells will not form columnar. These cells will start forming squamous. So gradually the columnar get replaced by the squamous. It is not the thing that the cell which is already columnar, it will convert into squamous. No, it cannot convert. Columnar will remain columnar only. Okay, now it is reprogramming. Now onwards, the stem cell will not form columnar. The stem cell will form squamous. So squamous gradually replace the columnar. Hana, initially stem cell was forming columnar, but now because of reprogramming it is forming squamous, or vice versa. Initially the stem cell is forming squamous. Now because of reprogramming it is forming the columnar. So you have to learn one thing, reprogramming of the stem cell. That is the mechanism. The mechanism is reprogramming of the stem cell. Learn this word. Now there are two types as I told you. You have to learn 4 examples of the squamous metaplasia and 2 examples of the columnar. So these are the 4 and 2 examples. So let's take the squamous metaplasia. Squamous metaplasia. What do you mean by squamous? What's the definition of squamous? Squamous means initially the organ is columnar. Because of the stress, it get converted to squamous. Because of the stress, it get converted to squamous. This is the definition of squamous metaplasia. So tell me 4 organs in human body which have columnar metaplasia. And because of the stress, it get converted to squamous. So rather than learning from the text, don't learn the text. See the diagram. In the diagram, you can learn it well. See the 4 organs in which initially there is columnar epithelium, and because of the stress it get converted to squamous metaplasia. Can you see here the first organ is the respiratory tract, the trachea, the bronchi, the lungs. What is the lining? It's columnar. Can you see in all of them one thing is common? Initially there is columnar. Because of the stress it get converted to squamous. The stress is different every time. The stress will be different every time. Okay, the first organ I'm telling you is the respiratory tract. Can you see the respiratory tract, the complete respiratory tract? The lining is the columnar. This is columnar. Okay, you can see it's columnar. The stress here is the smoking. The God has given respiratory tract for respiration, but some people smoke. Some people are smoking. The smoke is acting as a stress. Because of the smoke, the columnar get converted to squamous. Can you see the columnar get converted to squamous because of smoke? So here smoke is the stress. Because of the smoke, columnar get converted to squamous in the lung. Got my point? So that is the first organ. The second organ is the gallbladder. Can you see this one? It's a gallbladder. What is the lining of the gallbladder? The lining of the gallbladder is again columnar. And now, here the stress is the stone. Sometimes stone occurs in the gallbladder and that is acting as a stress. So because of the stress, it gets converted to squamous. So again in the gallbladder, due to the stone is calculus. Because of the calculus, columnar get converted to squamous. The disease is called a lithiasis. The third organ is the prostate. Can you see this is prostate? In the prostate, the normal lining is the columnar. Can you see this is columnar? The stress here is the inflammation, that is prostatitis. Because of inflammation, the columnar get converted to squamous. The stress here is the inflammation, that is prostatitis. That is third organ, prostate. The third organ is the prostate. And final organ is the cervix of the female. You have to understand it. Let me explain you cervix on the next page. So this is the uterus of a female. This is the cervix. And this is the vagina. Please understand. I'm asking you a question. Okay. See, the lining of the uterus is columnar. We all know. And the lining of vagina is squamous. I guess everyone knows that. Can I ask you the lining of the cervix? What's the lining of the cervix, which is a connecting thing between the uterus and the vagina? What's the lining? Is it columnar or squamous? Can you guess? Can anyone of you guess? Say, ma'am, both. We divide the cervix into two portions. This portion of the cervix is ectocervix because it is outside. And this portion of the cervix is endocervix. Okay, this is inside. So you can see ectocervix is squamous because it is continuation of the vagina. It is squamous. And you see endocervix is columnar because it is continuation of the uterus. This one is columnar. So you can see. So cervix will come in both metaplasia. So in endocervix, the columnar convert into squamous. Because of the stress, I will tell you what is the stress. And in ectocervix, squamous convert to columnar. What's the stress? I will tell you the stress. In both of them, the stress is different. So my point is that the endocervix is an example of squamous metaplasia because here finally squamous is formed. You can see. And ectocervix is an example of columnar metaplasia because here finally columnar is formed. So don't learn. I never learned this. I draw on the spot and make, use your common sense and you can make out. In endocervix, I'm saying there is squamous metaplasia. And in ectocervix, there is columnar metaplasia. You can make common sense because in endocervix, normally it is columnar. It get converted to squamous. In ectocervix, normally it's squamous. It get converted to columnar. You may be thinking, ma'am, what is the stressor? What is the stress in both of them? Now, this is the uterus. It is tied with ligament. If you cut the ligaments, the uterus will prolapse. Prolapse. Uterus will fall like this. It is the prolapse of the uterus. It will hit the endocervix, not ecto. So prolapse of uterus is acting as a stress. And the lining of the endocervix will convert from columnar to squamous. So prolapse of the uterus is acting as a stress for the endocervix. For ectocervix, axis hormones, that is estrogen and progesterone during puberty, that is acting as a stress. The axis of the hormones in the blood, that is acting as a stress, and that will convert from squamous to columnar. So learn. So cervix is coming. So currently I am teaching you squamous metaplasia. So endocervix is an example. The example here is the endocervix and the stressor is the prolapse. So what are the 4 examples I taught you? What are the 4 examples of the squamous? What are the 4 examples? We will see the 4 examples. Let me tell you the 2 examples of columnar also. Then we will see all 6 examples together. So let me tell you the 2 examples of the columnar metaplasia. Okay. So here the first example is the esophagus. The first organ is the esophagus. The lining of the esophagus is squamous. And the lining of the stomach is columnar. You know that. This is normal. We all have. So this is the junction. Why God has given 2 different lining in 2 different continuous organs? Esophagus is continuous with the stomach. Why the lining of esophagus is squamous, but here it is columnar? The 2 organs are continuous. There may be a reason, no? There is everything have a reason behind that. Because stomach is exposed to the acid. In the stomach, there is HCl. It is not there in the esophagus. It is not there in the esophagus because we have lower esophagus sphincter here, which is closed. Acid is not coming upwards. Got it? So columnar lining can bear the stress of the acid, but squamous cannot bear. That's why God has given columnar here and squamous here. This is the reason. Now some people have the loosening of this ileus. Ileus get loose and there is reflux. The acid is getting reflux. So reflux is known as GERD. gastroesophageal reflux disease, GERD, gastroesophageal. So that is acting as a stress. This acid is hitting the wall of the esophagus, the lower esophagus, not complete esophagus. It is the lower esophagus. The wall get hit by the acid, and that is acting as a stress. So the lower esophagus get converted from squamous. Initially it was squamous, and now the lower esophagus become columnar. So it is an example of columnar metaplasia. So this portion of the esophagus, the lower portion is known as Barrett esophagus. Can you see the lower portion here? See the lower portion here and see the lower portion here. I want you to highlight this portion here, which is squamous. But here the same portion become columnar. See the colors I have used. Okay, so this is the Barrett esophagus, the lower esophagus. The first example is the Barrett esophagus due to GERD. This is for your understanding. In your exam, you have to write down 2 words. Barrett esophagus due to GERD. That's it. You don't have to write the detail. This is happening. This is no. This is for your understanding. And the next example, you already know, the actocervix due to increased hormones, due to more estrogen during puberty. So this is all examples I have given you. You can see cervix is coming in both example. The endocervix is coming in example of squamous metaplasia. Here the stressor is the prolapse, and actocervix is coming in as an example of increased estrogen, the columnar metaplasia. The stressor is the increased estrogen. So we are done with metaplasia also. Metaplasia, the definition you know, it is transformation of one epithelia to another, either squamous to columnar or columnar to squamous. Okay, it is not physiological, pathological. It's always pathological. The 2 types, what are the 2 types? One type is squamous and one is columnar. Squamous metaplasia and columnar metaplasia. So in squamous metaplasia, one thing is common. What is that? The columnar epithelia get converted to squamous due to some stress. There are 4 examples I will be telling you. In columnar, the squamous get converted to columnar. Initially there is squamous and finally. So what is formed finally, you have to see. Here finally squamous is formed, that's why squamous. Here finally columnar is formed, that's why columnar. I guess you got it. So tell me the 4 organs here with their stress, and tell me the 2 organs here with their stress. Tell me the name of the organ. Here the 4 organ is lung, that is respiratory tract, gallbladder, prostate and endocervix. All these organs have columnar epithelium. All these organs. The stressor is different. Every time the stressor is different. You are getting my point. So in lung, the stressor is smoking. Due to the smoking, columnar get converted to squamous. In gallbladder, the stressor is calculus. Due to the stone, columnar get converted to squamous. In prostate, the stressor is inflammation. Due to the inflammation, columnar get converted to squamous. And in endocervix, the stressor is the prolapse of uterus, because of which columnar get converted to squamous. So one thing is common in all these 4 organs, columnar get converted to squamous. The stressor is different every time. The stressor is different. This is the best way you can learn, and you have to write this only in your exam and draw the diagram. Don't write the detail. Just write down the words. That's it. Okay. Now coming on the columnar epithelia, columnar metaplasia, the 2 organ is the esophagus. One is esophagus and one is actocervix. So in esophagus, the stressor is the GERD, gastroesophageal reflux disease, the reflux of the acid. And here the stressor is the estrogen in the blood. Because of GERD, the squamous get converted to columnar, that is Barrett esophagus. And because of estrogen, the squamous get converted to columnar in actocervix. So that is the disease this year. I hope you got it. Learn the organ, learn the stressor. That's it. And learn the 2 types of the metaplasia. So the 2 types of the metaplasia, we are done. They are in front of you. So learn. So this is the metaplasia. The last adaptation is the dysplasia. It is disordered cellular development. It's a pre-malignant condition. So there are 7 things which are happening in a cell. If all the 7 things are happening in one cell, you will call that cell as dysplastic cell. What are the 7 things? Let me tell you what are the 7 things one by one. Can you see this is a normal epithelia and this is dysplastic epithelia? Compare the normal epithelia below which there is subepithelia. See the cells here. Below which there is subepithelia, and see the cells here. So this is dysplastic. So normal get converted to dysplastic. There are 7. You have to learn the 7 changes. The first change, the number of the layers. Here we have 1 layer. You can see here we have 1 layer, and here we have multiple layers. The number of the layers is increased. You can see, don't learn, see in the diagram. So first change is increase in number of the layers. The first thing, you can see the increase in number of layers. Number 1. Number 2 is the arrangement. See the arrangement here and see the arrangement here. Here the arrangement is ordered, very uniform, orderly arrangement. Here the arrangement is haphazard, disorderly arrangement. The arrangement become haphazard. So second is disordered arrangement. Disordered arrangement. So see the number of the layers, number one, here multiple. Here, see the arrangement, here orderly arrangement, here disorderly arrangement, the second. The third is the polarity. What do you mean by polarity? See, this is basement membrane. Where is the nucleus of all these cells? See, I'm drawing on the next page. See, this is basement membrane, this is basement membrane. This is normal. These are normal cells. Hana? These are normal cells I'm drawing. And these are dysplastic cells I'm drawing. They have multiple layers like this. This is just plastic cell. Now, where is the nucleus here? The nucleus of all these is towards the basement membrane. Towards the basement membrane. This is normal. But the nucleus become away from the basement membrane. The nucleus become away from the basement membrane in dysplasia. So here the basal polarity is present. Basal polarity means the nucleus is towards the basement membrane. Here the basal polarity is lost. The basal polarity is lost. The nucleus is away from the basement membrane. The basal polarity is lost. That is the third change. I hope you are getting it. That is the third change. The fourth change is the pleomorphism. You can see that also here. Here all the cells are uniform. They are same size. They are more or less they are same size. So pleomorphism is absent here. Pleomorphism is absent. Here some cells are small, some are moderate, normal, some are large. So here pleomorphism is present. Okay. So you can see the changes. Here in dysplasia, there is loss of polarity, loss of basal polarity, and pleomorphism is present. You can see all the cells are here uniform. They are uniform here. Here some are small, some are normal, some are large. So here pleomorphism is present. That is the fourth change. Fourth change is pleomorphism. The fifth is the NC ratio. What is NC ratio? Let me draw. So let me draw a normal cell here and a dysplastic cell here. Let me draw a normal cell. It's like this. It's like this. It's like this. And dysplastic cell is like this. They are big cells. Here nucleus is small, cytoplasm is more. Okay. Here nucleus become more large and cytoplasm is relatively less. I hope you are getting what is NC. Nucleus का size upon cytoplasm का size. Nucleus का size upon cytoplasm का size. NC ratio. So what is the size of nucleus? Here it's less, cytoplasm is more. And here the nucleus is more, but cytoplasm is less. So numerator is more, denominator is less. So NC ratio is more here. Here the NC ratio is normal or less. Here NC ratio is more. You can understand the size of the nucleus versus cytoplasm. Okay. So that is NC ratio. So here NC ratio is more. In dysplasia, the NC ratio is increased. That is the fifth change. The sixth change is the chroma. Chroma means color. The color of the nucleus. The color. See the color of the nucleus over here. It's light color relatively. But in dysplasia, the color of the nucleus becomes dark, compact. The chromatin is compact. So here the nucleus ka chroma, the chroma of the nucleus is normal. It is normal chromatism. It is normal normochromatism. Here it's hyperchromatism. The chromatism is more. The nucleus ka color. Okay. Last is mitotic activity. The mitosis. Here I can't see any mitosis in the nucleus. But here if you see, some of the cells will show spindle formation. Can you see spindly, not very clear. But some of the nucleus is showing spindle formation. That is mitosis is common. So what are the 7 changes? Can you enumerate the 7 changes one by one? See the 2 diagrams and tell me the changes of the dysplasia. Normally number of layers is 1. But here number of layers is increased. So increase in number of layers is dysplasia. Secondly, the arrangement is orderly normally, but here the arrangement become disordered. So disordered arrangement is dysplasia. Define dysplasia. Don't define normal. Define dysplasia. Increase in number of layers, disordered arrangement, the basal polarity is lost. Normally basal polarity is present. The nucleus is towards the basement membrane. Here the nucleus is away from the basement membrane. So basal polarity is lost. Pleomorphism is present. That is, some cells are small, some are large. That is variation in size. NC ratio is increased. The nucleus become dark color. That is hyperchromatism. And mitosis is more. So these are the 7 changes of dysplasia. Can you define what are the 7 changes of dysplasia? There are no types of dysplasia. There are 7 changes of dysplasia. What are the 7 changes? Number 1, the number of layers is increased. Number 2, the arrangement become disordered. Number 3, the basal polarity is lost. The nucleus is not towards basement membrane. It's away from the basement membrane. But pleomorphism is present. That is variation in shape and size of the cell. Hyperchromatism is seen. The chroma, the color of the nucleus is more. NC ratio is very high because numerator is more, denominator is less. Okay, nucleus ka size is more, cytoplasm ka size is less. And mitosis is present. Mitosis is present. So all the things are present except basal polarity, which is lost. Remaining all are present. So this is the definition of dysplasia, and you can draw, you have to draw this diagram to show, rather than writing, try to show them in the diagram. All these things are shown in the diagram. That is dysplasia. So this is the 5 type of adaptation. We are finally done. What are the 5 type of adaptation? Let's revise it quickly. Hyperplasia, hypertrophy, atrophy, metaplasia, and dysplasia. Write down the definition of all these. I guess you already know the definition of all these. See the definition of all these. Please learn. Draw the diagram of all these. I guess you already know the diagram of all these. Tell me the mechanism. In hyperplasia, the mechanism is increase in growth factor and growth receptor. In hypertrophy, the mechanism is increase in cell organelle. In atrophy, the mechanism is decrease in cell organelle. In metaplasia, it is reprogramming of stem cell. I have told you. And dysplasia, there is no mechanism here. Here, the two types, you know, physiological, pathological, the 3 examples here, the 3 here. Here also 2 examples here, 2 here. Here also 4 examples and 7 examples here, physiological. But in metaplasia, it's not physiological, pathological, it's always pathological. So the 2 things are squamous and columnar. So you know the examples here. And in dysplasia, we don't have any types. We have only 7 changes. I hope it's crystal clear to you. Now any long question, short question, or very short question coming from this topic, you can answer easily. If any one of them is asked, write down that. If 2 of them are asked to differentiate, write down that. If it is a long question, they are asking all 5, write down that. Okay, so I hope this topic is crystal clear to you. We are done with the first topic.